Somebody took... If you'd like to find your seats, ladies and gentlemen, I would like to get the meeting underway, please, in a moment. Good afternoon, everyone, and welcome to the Board of Health meeting here this first day of May 2018. Councillor Geisens has notified me that he'll be absent from the Board of Health due to personal business. I believe he'll be here for the council meeting. I have not heard from Councillor or Member Height at this time. Again, I would like to remind you and myself that our meetings are televised and they are web streamed. And if you have a cell phone with you, if you can have a look to make sure it's on silence mode, that would be very, very much appreciated. Judy Ann McCauley is again volunteering to assist with the camera today for our broadcast. Is there any disclosure of pecuniary interest for this board meeting? I have some changes to suggest to you for approval. We have two consent items, and you can see under item 5. There is HSS 1821, and there's also a consent item 1824. I have Board Member Brunton moving and Board Member Sonnenberg seconding that the following items be moved from the consent items to discussion items as items, well, it says here A and B, but we already have an A, so they should become B and C.
They move to the top of, they would move to the top of consent items or discussion items.
So they would be A and B, and then A would be C.
Correct.
See how I figured that one out on my own? Thank you. So they will be moved as items A, that's HSS 1821, B would be 1824, and 1823 would be then item C. Any discussion on those changes? Board members, those in favor? So that's what we will do. Anything else to be brought to my attention on changes, additions? That's carried. We will proceed as per your instructions. We have a presentation today. We have with us an interim acting medical officer of health. Ms. Miranda, I'm going to turn the honors over to you to introduce the doctor, please.
Thank you, Mr. Mayor. I'm quite excited to introduce to the board and to our community Dr. Elizabeth Herbanke, who is our interim acting medical officer of health. She joined us a couple of weeks ago. She'll be with us 2 days a week and available 24/7. She currently is the chief of emergency medicine at the Woodstock Hospital and the investigating coroner of Oxford County. And she has recently also held an acting MOH position for the Oxford County Public Health. So we're really thrilled to have her on board with us until our medical officer of health joins us, our full-time medical officer of health joins us in October. So welcome to Norfolk County and welcome to the Board of Health. And we've been keeping her very busy in her short tenure here, and she's become very well versed in some of our local issues.
Thank you very much, Marlene. And Dr. Herbanke, I want to welcome you on behalf of this fine Board of Health and say to you how pleased we are to have you aboard and hope your stay here with the Haldimand Norfolk Board of Health is lots of fun and a little bit of work too, I'm thinking. Yeah, so, and Marlene, if I can, to you, and your staff and all those that have been involved with the recruitment process. I know you've worked a lot of hours, you and your team, and so I want to express our thanks for all the work you've done. It's great news, and again, welcome, Doctor. I am going to go to discussion items now. Wait a minute. You've got something for me. Oh, boy, you're keeping me on my toes today. I'm so excited with our new medical officer of health. I'm just skipping the good stuff here on the sheet. Item number 3, adoption correction of the Board of Health meeting minutes. We have our Board of Health minutes from April the 3rd, and we also have the Special Health Board of Health minutes from April the 10th, and distributed under separate cover, of course, of the special closed session minutes from April the 10th. Are there any errors or omissions, anything you want to bring up from those minutes? Seeing none, those minutes are now declared adopted. Now I'm going to attempt to go to the discussion items. I got the thumbs up to go to the discussion items. Our first item is HSS 1821, and we're on page 11. This is the annual service plan and budget submission. Marlene, please.
Thank you, Mr. Chair. I'm going to ask Ms. Taylor to present the following report.
Thank you, Ms. Miranda. Through you, Mr. Chair, to the Board of Health. The purpose of this report is to inform the Board of Health of the annual service plan and budget submission that was made to the Ministry of Health and Long-Term Care on March the 1st, 2018. This submission includes both cost-shared and 100% funded programs that are funded by the Ministry of Health and Long-Term Care. Just to reiterate what's in the report, that the submission does not include those programs that are funded through the Ministry of Children and Youth Services or through the primary care branch of the Ministry of Health and Long-Term Care. So those submissions go in separately. The annual service plan and budget allocation submission describes the work that is planned within the existing Board of Health approved budget, the current budget being $8,173. And the document just follows the structure of the new Ontario Public Health Standards and describes then within those standards how we will allocate those funds. For the first time in many years, though, this time the Health Unit was invited to provide submissions for additional base funding and one-time funding requests. And so staff has actually submitted a total of $2.2 million in base funding requests and $758,000 in one-time funding requests. Again, I want to remind the board that should we be successful in any of those funding requests, we would come forward with a subsequent report to the board requesting acceptance of those funds and describing at that point what the levy impact, if any, would be. And with that, I think that, one of my last point in here was I did want to also highlight that the report that has gone forward doesn't actually represent those times where a Board of Health might be required to make decisions. It actually looks at how are we going to use the allocated funds as they stand now. Down the road, we may be requiring our staff and the board to make those decisions, but that would be coming at a later date. So with that context, I'd be happy to answer any questions.
Any questions? Ms. Taylor? Mr. Oliver?
Thank you, Mr. Chairman. Thank you, Susan, for your report. I'm looking at page 12 of our agenda, which is page 2 of the report near the bottom, where it talks about the additional base funding requests. You mentioned $2.2 million. I understand that fully. And then the first bullet in the last paragraph that talks about $950,200 to rebalance our provincial municipal resources. Can I conclude from that then that this would bring all of our underfunded cost share or 100% funded programs up to a level where they are funded in accordance with the formula that we've struggled to get to for the last all the years that I've been here, which is almost 12?
And through the chair to the Board of Health, that is absolutely correct.
Okay.
So that $950,000 represents, if it was a program that's 75-25, and that's what it ought to be, then it would represent that level setting. If it's a program, and there are a few of our programs that are 100% funded for staff, and so it would provide that staff funding for that 100%. Yes.
Thank you. And my second question, if I could, Mr. Chairman, on the same paragraph, in the text, it talks about 13 FTEs that would be created relative to the additional 1.26 million.
Yes.
And I understand that, but when I look then at the items identified within the brackets, none of those are positions we have now, then I gather, either in a contract capacity or a part-time capacity. These would all be brand new,
Yes.
not previously existing FTEs.
Through the chair to the Board of Health, that is correct.
Okay.
These would be net new positions that are required to fully deliver on our mandated services.
Okay. So in fact, we're then, if you like, understaffed to provide the services that we are supposed to be providing by not only those 13, but conceivably by the other 5.5 or 6, yes, 5.5, I think, that you're talking about, or maybe you'll address those separately. But these are staff resources that in order to deliver the programs we're mandated to, we should or could add them now.
So through the chair to the Board of Health, that is absolutely correct, that in order to fully deliver on our mandated services, we would require the 13 FTEs, or net new positions. The 5.5 FTEs that are identified under the one-time funding requests, those would be positions that, if we are not successful in those, then we might look at how else might we manage our budget. So for example, if we had some gapping dollars, might we be able to allocate to those?
Okay, thank you, Mr. Chairman.
Mr. Oliver, Mr. Black, please, and then Broughton.
Thank you, Mr. Chairman. Thank you very much. And Member Oliver, I think, asked my question probably better than I would have, but I was concerned about the number of new staff members as well. And I guess what I would be concerned about, and this whole council has said it before, you know, if the rug is pulled out from under us, the funding rug, so to speak, does now the local taxpayer have to pay for those employees, or do they disappear along with the extra funding that comes down?
Through the chair to the Board of Health, it's a bit of speculation on my part, but if I were to say, if there was a change to the structure of health units, then those positions would need to follow and be built into that structure in some way, shape, or form. However, of course, we can't anticipate what that could look like.
Okay, but what I'm worried about is, you know, they give us the funding, and this council's already talked about, you know, the different allocations, and yet they're underfunded. So we get stuck, well, shouldn't use the word stuck, but the local taxpayer has to pick up that difference between the lack of funding that the provinces said they will give us. So in this situation, they're giving us a whole lot of money to hire a whole lot of people. So if that whole lot of money disappears, what happens with those employees?
So through the chair to the board, again, just to clarify, this is what we've applied for, so it doesn't necessarily mean that we will be successful in that application. And so that, I think, is the first point of consideration for the board. This is what we've applied for. We would bring back a subsequent report should we be successful in those applications. And then at that point, we would have more details around what portion or all we're successful in, and then be able to have that discussion with a bit more detail.
Oh, okay, well, I might as well say it right here now. Like, that's my concern. I'm sure it's concern of a lot of the councillors around the table, that when the province gives us the money, that's great, you know, to perform their mandates and their business, like they're using us as a vehicle to deliver that service. I want to ensure that the money is coming from the province and not the local taxpayers. Thank you.
Mr. Brunton.
Thank you, Mayor Luke, through you to Susan. Susan, I missed this at the advisory committee, but on page 14, it says, number 3, one-time funding request, cannabis prevention / protection health promoter. I assume that's a position is that something we are going to create, or is that a position the province is creating?
So through the chair to the Board of Health, that would be a position that we've applied for one-time funding, recognizing that with cannabis being an issue that has some prevalence within this community and some concern within this community, that we would want to be able to dedicate some resources of a health promoter. So it would be a position that would be created by our health unit. We do have other health promoters, but this would allow us to have the bandwidth to dedicate resource towards cannabis prevention and some of the information that goes along with that.
But is that a position? I assume it means the hiring of one of the 18.5
Yes.
full-time equivalent. I just find it odd that the federal government's promoting it, yet the provincial government's trying to stamp it out, if I could use that word, somewhat like smoke-free Ontario, where we still have smokers or grow tobacco and all these things, but what do we spend, about $400,000 now on the smoke-free budget totally, I think, and we have, 3.9 employees in that area, I believe. Just, I guess it just boggles the mind how both levels think. Thank you.
Mr. Wells?
Well, thank you very much, Mr. Mayor. Mr. Mayor, in some ways, this is extremely good news if we are successful. In other ways, it's bad news, because in spite of what we may think about here, there's only one taxpayer, and that money has to come from somebody. So if we're getting it from the province, and the province is already tight according to the papers, they'll have to get more money. And where they're going to get that more money is from us. So what we win in the bananas, we're going to lose in the grapes. Thank you, Mr. Mayor.
Any further questions on this report? It's been moved by Mr. Columbus, seconded by Mr. Sonnenberg. Staff report HSS 18-21, annual service plan and budget submission be received as information. Any discussion? Mr. Oliver.
Thank you, Mr. Chairman. I guess just one last comment. I think all of us around the table certainly appreciate and support what staff have done relative to the $950,000 to bring our cost-shared programs up to where they should be. And I think even if that's all we get, I think that would be a huge step in the right direction for this Board of Health. And I expect, I say this to my colleagues, I'm sure as Susan pointed out to us, we would receive further reports before anything else, if you like, involving FTEs would go forward. So we would get another kick at it. But I think we have to support this, even if it's only for the $950,000.
Mr. Wells?
Could I ask staff one question?
Sure can.
Most boards of health find themselves in the same similar situation, being underfunded in their programs. We surely can't be the only one.
And through the chair to the Board of Health, that's absolutely correct. Most boards of health have found that since 2014, in the funding formula that was instituted at that time, that the variance between what the provincial funding is and what the provincial funding perhaps ought to be has been growing.
Thank you, Mr. Brunton.
Just one other question, Mayor Luke, if I may, to Susan. Susan, if I remember right, in our last couple of annual budgets for the Health Board, we've had a 10 and almost a 19% increase in the tax levy portion, roughly, of the Health Board budget. Don't quote me on that, but I guess my question is, if we were to receive all this funding, would we be able to reduce some of the tax levy requirement in the Health Board budget?
So through the chair to the board, much of that tax levy impact is because of that growing gap between the anticipated provincial funding and what actually happens. So our funding has been flat since 2014, and meanwhile, our staffing costs is one good example where there's an annual cost of living change that hasn't been reflected in the funding, and so of course that gap gets bigger, which then means the percentage is bigger. So this would certainly narrow that quite substantially if we were successful in receiving all of the funding that we've put forward.
So you're saying we would be able to reduce the tax levy requirement, or we won't?
If we receive the funding that we've put forward for, then yes, we would reduce the tax levy requirement.
Thank you.
Mr. Block?
Thank you, Mr. Chairman, and not so you get the wrong impression there. With me, I do acknowledge that staff know the thinking of this group and have been acting accordingly and have supported our position and have been proactive in trying to get funding along with other areas. So I just want to say I appreciate what you've done in helping to get that balance and provide, at the same time, provide the needed service in the area. And just thank you for that.
Discussion? Columbus?
Yes, I was just curious. Obviously, there's been a great deal of a discussion about this, and it was actually listed as a consent item, which would have meant there would have been no discussion, right? And I just wonder what the criteria is to have it as a consent item versus not a consent item, because there has been, it's a very important report.
I guess staff has to decide which item to put it under, and it's certainly our privilege to move it from consent to discussion. So I don't have a problem with that system whatsoever. Understand what you're saying.
Yeah. So through the mayor to Councillor Columbus, staff will take that ownership. It was an error. It should not have been under consent item, hence we revised the agenda today. We felt, just as you are currently stating, that it was important to have this discussion with the Board of Health. So it was an oversight on staff's, at the staff level, and so we have rectified it.
Thank you. Any other discussion? 1821, receive as information. Those in favor? Carried, thank you. I'm on page 21 now, folks. This is 1824. It's an internal review of infection prevention and control practices in the Haldeman Norfolk Health Unit Oral Health Clinics. Marlene, please.
Thank you, Mr. Chair. I'd like to introduce to the board Marsha Vandenbush. Marsha is the program manager of school health, oral health, and the speech language pathology, and she is going to present the next report.
Thank you, Ms. Miranda, and thank you, Mr. Chair, and through you to the Board of Health. I am going to be discussing the experience of the Health Unit's oral health program with our infection prevention and control review that took place this past fall. So first, I would like to talk to you a little bit about the oral health program. There are two main components of the oral health program: oral health screening and the Healthy Smiles Ontario program. Oral health screening takes place in all publicly funded elementary schools and also at our Health Unit community clinic sites. Children in need of dental care are identified through screening, and then staff provide navigation and case management to ensure the provision of treatment. Healthy Smiles Ontario is a free dental program for eligible children 17 and under. The Ministry of Health and Long-Term Care provides 100% capped funding to the Health Unit to promote and facilitate the enrollment of eligible children in Healthy Smiles Ontario, to help families to access dental care, and to provide preventive dental services. And that includes things like cleaning and sealants and fluoride varnish. So the Health Unit has multiple preventive services sites. We have our Simcoe office, Dunnville office, and Caledonia office, where we have select days where preventive services take place. We also operate out of the Langton, Norfolk County building and the Help Center in Southwest Norfolk. So that's a little bit about our program, and I'll go on to infection prevention and control. So infection prevention and control, or IPAC, as you may have heard it referred to as, are practices and procedures that prevent or reduce the risk of transmission of microorganisms to providers, clients, and visitors. IPAC expectations and recommendations for dental settings have evolved and improved over the last few years, and that prompted our program to conduct an internal review. So we asked our health unit IPAC practitioner to assist us through that process. The review identified 3 main areas of improvement. They were strengthening policies and procedures, improving staff education and training, and enhancing our physical space where reprocessing takes place. While several policies and procedures were already in place to guide clinical practice, the review highlighted many that were needing some updating or creating to support practice that was already happening. Those are all now complete. With respect to education and training, IPAC is part of the college courses that staff take in preparation for their role, and they did demonstrate competence in the reprocessing and sterilization of dental equipment, but infection prevention and control practices are always changing and evolving, so we will have staff doing refresher courses every year, and we've also identified a lead within our program who will take a more advanced course. And then finally, we had a renovation to our reprocessing area in the Simcoe office this past March. And the main changes are that we have a separate area with more counter space and an additional sink and eye wash station. And so during the time that we were having the renovation, children that were in need of preventive services were either referred to local dentists where possible, or they were put on a wait list, and we are now booking those clients back in the clinic. So finally, our IPAC practitioner at the health unit has now done a follow-up review, and I'm happy to report that we are compliant in all areas. And I'll take any questions.
Very much. Marcia, and questions, Mr. Columbus, please.
Yes, with respect to page 23 of the agenda, the enhancing the physical space, what all actually takes place? I take it that's at Gilbert Health Unit, where your office is. What all actually takes place there? What are the activities?
Through the chair to the Board of Health. So at the Simcoe Clinic site, we have a clinic room where children and youth would come in and they receive preventive services. So like I mentioned, cleaning, sealants, fluoride varnish, and screening. And that is also where we reprocess or sterilize all of our dental equipment at that site for all of our clinics and all of our screening sites as well. So the space that was renovated is attached to that clinic room, and it was an addition of a longer counter space so that we could have more room for the flow from dirty to sterile, and an addition of a sink so that the equipment could be rinsed and that kind of thing.
So there's actually a dental chair there with the proper lighting and everything?
That's right.
Is that right? Okay, I wasn't aware of that. Thanks.
Mr. Height, please.
Thank you, Mr. Chair. Through you to staff, do you have the enrollment figure for the Healthy Smiles program? Like how many children had work done last year?
Thank you. Through the chair to the Board of Health. I do not have those numbers with me right now. We can provide the numbers of the children who came through the preventive clinic in all of our sites. And the enrollment in Healthy Smiles Ontario, we are able to provide, there's different streams in Healthy Smiles Ontario, and we are able to provide the enrollment rate in our core stream. But their families are welcome to enroll in Healthy Smiles outside of the health unit, so they can do that directly through a website, and so we don't have those numbers.
Okay, so let me ask you this. If they can enroll outside, does that mean like they come and see the dentist on site? Because on one of these things where you did some renovations, you were referring them to another dentist, like private dentists. So why aren't we referring them all to private dentists?
So through the chair to the Board of Health. So we do not have a dentist on staff. The only services that we provide are preventive. So they're delivered by a public health hygienist. And so Healthy Smiles Ontario, there's different streams in the program, but if a child is requiring treatment, they can go to a dentist to receive things like fillings and those services beyond preventive services. Now, part of the Healthy Smiles Ontario program is that if you're financially eligible and clinically eligible, you can receive receive a Healthy Smiles Ontario number, which means that you can see the dentist and receive free dental services through that program. So there's different streams, and the service that we provide is the preventive part of that, as well as facilitating enrollment in the program so that more children can access dental care.
Okay, thank you for that.
Further questions? Moved by Mr. Sonnenberg and seconded by Mr. Oliver, the staff report. HSS 1824, an internal review of the infection prevention and control practices in the Haldeman Norfolk Health Unit oral health clinics be received as information. Any discussion? Those in favor? That is carried. Thank you very much, Marcia, for your report. On to page 25, HSS 1823. This is the organizational audit update.
Thank you, Mr. Chair. This is just a routine update on our audit recommendations that Ms. Taylor will present to the board.
Thank you, Ms. Miranda. Through you, Mr. Chair, to the Board of Health. The purpose of this report is to update the Board of Health of the Health Unit's progress in addressing the recommendations from the organizational audit. The objectives of this audit included assessing governance and management practices that demonstrate compliance with the Ontario Public Health Organizational Standards, the Public Health Accountability Agreement, and the Public Health Funding and Accountability Agreement. As a reminder, this was from the years 2013 and 2014. The scope of the audit did not include an assessment of the provision of services under the public health mandate. So, for example, under health protection, disease prevention, or health promotion. At the time that this report was written, the Health Unit had addressed 71% of the recommendations, so had completed recommendations, 29 of 42 recommendations that fell within the Ontario Public Health Organizational Standards, and 5 of 6 recommendations that fell within the Accountability Agreement and the Public Health Funding and Accountability Agreement recommendations. There has been additional progress since the time of this report, and we are targeting submission of an update to the Ministry of Health and Long-Term Care in the near future. With that context, I'd be happy to answer any questions.
Boy, lots of progress here. Questions? Mr. Black, please.
Mr. Chairman, through you to staff, and I know this has consumed a lot of time and energy by staff to do this, and something that sort of came out of the blue. I mean, in the end, it's a good thing to get well organized and up to speed, but my question is, how much has this taken away from staff's regular duties, regular performance to address the audit from the province? Maybe it's not a fair question, I don't know.
So through the chair to Councillor Black, a bit difficult to answer that question because we're continue to fulfill the mandate as per the public health standards. A lot of the work has been done after hours, to be perfectly honest, and a significant amount of staff, requirement to follow through with this. And you can appreciate how many recommendations there actually were, and some of them being very complex and time-consuming. So it has been a lot of work, and kudos to the staff and our support systems in corporate services, IT, HR. Everybody's working collectively to pull it all together. So I would say that we're maintaining our mandate, but not without a lot of added work.
Well, I can definitely see how much work that you must be going through, because it's a lot more effort on my part, and I'm sure everyone else's part. There's a lot more reading to do to go through all of what you have done. So I'm just wondering, has the province recognized that and sent down additional funds for that, or is that they just expect that?
So through the chair to Councillor Black, the board will recall that we did put in a one-time grant request last year that unfortunately was not successful. It is the expectation of the board and the health unit to have these recommendations fulfilled to fulfill the mandate. So there were no added funding provided to us.
All right. Thank you very much.
Mr. Height, please.
Thank you, Chairman Luke. Through you to Ms. Taylor. I'm looking on page 33 of our agenda, or 1.17 is the number here. It talks about a service level agreement, that it should be established. and provided by Norfolk County. I'm wondering, it's still in progress of where are we at with that and when do you expect that to be completed?
So through the chair to Councillor Height, we're still working on it, and we don't have a definitive timeline. You can appreciate that that will encompass a lot of different departments and our collective partner in Haldeman County, so it still is a work in progress. So we can bring you a timeline, but we don't have one currently.
Okay, I guess I'm troubled with what's taking it so long. It's a service level agreement, you're in the services business. Maybe I'm missing something here.
If I may, through the chair to the Board of Health, I would suggest that we have, for reasons of practicality, we've prioritized some of the requirements to ensure that we were moving forward on those ones that had the most direct operational impact.
Okay, thank you for that. My next question would be on page 39, and that's 1 point, I don't know what that is, 3.4, I guess, and it's just, I was pretty shocked to read that employee performance appraisals aren't done on an annual basis. I wouldn't think any government organization wouldn't do those yearly, and they're still not getting done. What's the hold up there? Like, if everyone's in place, they should just get tagged into a calendar and done, should they not?
So through the chair to the board, we actually, as of last week, for the first time, at least since I've been with the health unit, starting in January of 2017, we have our full management team in place. So it has taken time to get our full management team on board, in place, and during that time period, then unfortunately it has meant that there have been some employees who haven't had their performance appraisals done on time. So there is a plan to move that forward and to get everybody caught up.
Okay.
Yes.
It's just a plan, they're not done yet.
That's correct.
Okay, thank you for that, Ms. Taylor.
Anything further? Then it's been moved by Mr. Columbus, seconded by Mr. Oliver, the staff report 1823 organizational audit update be received as information that the Board of Health endorse the Haldeman Norfolk Health Unit management responses to the audit. Recommendations, discussion. Those in favor? Carried. Thank you, Susan Taylor. Page 45. This is the memo from Kristen DeMulemeister on the purchasing agent, delegated purchasing authority activity from July 1st to December 2017. It's been moved by Mr. Columbus, seconded by Mr. Sonnenberg, that the staff memo from Kristen DeMulemeister regarding delegated purchasing authority activity from July 1st to December 2017 be received as information. Discussion? Those in favor? Carried. On to communications, page 49. This is a letter from Halliburton, Kawartha, Pine Ridge District Health Unit, the 2018 annual service plan, and they are requesting a 2% increase from funding from MOH LTC, and also in the letter I read that they would certainly appreciate an earlier budget approval. And discussion here. Moved by Mr. Sonnenberg, seconded by Mr. Columbus, that the communication item from the Pine Ridge District Health Unit regarding their 2018 annual service plan be received as information. Discussion? Those in favor? It's carried. Thank you. Any other business to come before the Board of Health? I have one question, Marlene. What? You have some other business? Well, please.
I'm going to turn it over to Ms. Taylor.
Thank you, and through you, Mr. Chair, to the board. Two other items under other business. The first one is an update about the enforcement of the Immunization of School Pupils Act, or ISPA. We are currently under the suspension process. So folks will remember that we are mandated as part of the health unit mandate to enforce that students who are enrolled in schools, both secondary and primary schools, are immunized against designated diseases or have a valid exemption on file. We started off with the review of 1,794 students. Back on March 26, we sent letters to 799 students and families. When we went into suspension last week, so on the 26th of April, between that time and the 26th of April, we went from 799 down to 123. So that means that our staff were able to work very closely with families to ensure that records were updated and or students received their immunization. Our current status as of yesterday is that there are still 79 students from both 7-year-old and 17-year-olds combined who are still currently suspended. So those numbers continue to drop. I do want to say it's been a tremendous amount of work on the part of our staff, and wanted you to have that information because it's most current.
On that, please.
That's excellent work, that's for darn sure. And you would have a percentage breakdown, like what would that 79 as a total represent?
So we have the breakdown that is by school, by age, all of those sorts of things. And so I could find that for you, but I think for the purposes
Okay, I was just wondering out of the total number of students that fall into this category, what percentage is 79?
Oh, I see.
It's not it's not that super important, it's just curious. That's all.
Probably about 5%, so
Okay.
79 of 1,794.
Okay, right. And then would some of those have issued exemptions? Is there an exemption form, like based on religious grounds or that sort of thing? And then that 79 actually would come down even further, would it not?
So through the chair to the board. So first of all, the 79 of the 1,794 is 4.4%. So that's where we're sitting right now. We'll continue to work at that number, and you're absolutely correct that there will be some students who receive their immunizations. There will be others who we meet with their families and they choose to be exempted. But there is an education process that we need to go through, and we meet with families on an individual basis to do that.
Yeah. Yeah, I did know of a circumstance a few years ago where exemption was applied. A family did leave the country, come back, and they did infect the school.
Any other questions? Mr. Oliver?
Thank you, Mr. Chairman. We receive this report every year, Susan, and it always strikes me as maybe not shocking, but certainly discouraging that we have such numbers every year. How do our numbers compare this year as compared to last year in terms of, you said 4.4% of the student population falling within the range that has to be immunized are under suspension, in other words, not doing it yet. Is that an improvement over last year or okay, it is?
So through the chair to the board, it is most definitely an improvement. So at the end of the suspension process last year, so remembering we're not even a full week into suspension yet, and so not even a full week in, and we're at 4.4%, so that means that 94% or 96% roughly have been immunized. Last year, we were in the magnitude of 89 to 90%.
Okay, so that,
Yeah,
okay.
so quite significantly better.
At least it's going in the right
It's
direction.
quite significant.
Yeah.
Anything else? I do want to thank you, Susan, for that work, and trust me, it is a very time-consuming.
Yeah.
Yeah, they could save us a lot of time if we didn't reach that suspension day. You had another item?
I do.
Yes.
So this was just to raise awareness on the part of our Board of Health that next week, May 7th to 17th, is National Nursing Week. I'm proud to say that Haldeman Norfolk is the home to 38 nurses in our family, and that includes 30 public health nurses, 1 nurse practitioner, 4 registered practical nurses, and then 3 members of our management team are nurses as well. Our team of nurses includes one individual who has been with the health unit since 1975. That's a really long time and really quite impressive. And then we have also, of course, some new grads. So we have a nice array of longevity amongst our nursing staff. Over the past year, our nurses have contributed to the health and well-being of our community, and they've delivered valuable and valued services. They've visited new moms and babies, they've vaccinated children, provided sexual health clinics, they've helped people quit smoking, they've implemented needle exchange programs, and ensured that our infection prevention and control standards are met. They contribute to healthy schools and healthy communities, and they represent the health unit with confidence when they're presenting both at conferences and in the community. So with that, I'd like to say that next week when you're around, say thank you to a nurse and just to recognize that we appreciate all that they're doing with us and on behalf of the health unit.
Thank you. Any other business to bring before the board? Susan, I have one question.
Yes.
I just last week received, I think this is the second call since January, from an adult who needed dental work for an aching tooth, did not have the money, is actually going to write this board a letter asking that funds be provided. Now, we did provide funds in one budget. I believe it was for adults to have one annual cleaning, I believe, but we have no funds for a tooth to be extracted or a filling or whatever. Is that a fair statement?
So through the chair to the board, from the public health perspective, it is for children. However, the council actually will recall that we did request some additional funds for dental screening and some minor work through the social services program, and that is being utilized. So there is some ability for certain participants who are eligible to require some preliminary dental work.
Okay, because both calls I have said they had been in contact with the the health unit and were told that there was not money to cover. And I have to say that in both cases I referred them to call their dentist because I am aware that some dentists will go ahead and do the work and try to work something out with the patient. And the one call actually called me back and said that indeed had happened and she was no longer in pain. And the dentist actually followed up with me and thanked me for referring that lady to the dentist's office so that they could treat the patient. So I just wanted to be sure I was giving the right message there, and I know a letter is forthcoming, so I just wanted to bring that up here. Confirming bylaw for the proceedings of this meeting, I have a seconder, which is Mr. Sonnenberg. I do have Mr. Wells willing to move it. The bylaw is 2018-07, Board of Health. It's being a bylaw to confirm the proceedings of the Board of Health for the Haldeman Norfolk Health Unit at this Board of Health meeting held on the first day of May 2018. It be passed, signed by the Mayor and Clerk, and affixed with the corporate seal. Those in favor? That's carried. We're adjourned. Thank you very much, everyone.